Hey everybody, today I'm going to talk about reactive attachment disorder. What is it and what are our treatment options? Now, reactive attachment disorder falls under trauma and stressor related disorders. And I'm looking down because I got my handy dandy DSM. And as you know, as I always say, it's not the end all be all, but it helps us categorize things that we may be feeling and experiencing, and it helps us get coverage by insurance. So it's under trauma and stress related disorders. And I think that's important to mention because reactive attachment disorder is something that happens to children who have witnessed or been in a very traumatic either one experience or upbringing as a whole. Now I'm just going to read you some of the diagnostic criteria for reactive attachment disorder, and then we'll kind of get into the nitty-gritty about why it happens, where it comes from, and what we can do to fix it. So the diagnostic criteria starts out with a consistent pattern of inhibited, emotionally withdrawn behavior toward adult caregivers manifested by both of the following. So you have to have these. The child is rarely or minimally seeks comfort when distressed, or the child rarely or minimally responds to comfort when distressed. So the best way that I can describe this is children who may, like let's say, fall down and bump their knee and they start crying and they don't want anybody to help them. They don't want the parent to come. If the parent does, they withdraw. They usually don't want any comfort, which, as we know from if you've been around children, is not the normal experience. And that's when, as a clinician, we would consider looking into this and maybe getting the family some help. The second criteria is a persistent social and emotional disturbance characterized by at least two of the following. So there are three, and they have to have two of these. The first is minimal social and emotional responses to others. Like I said, it's like withdrawing and looking away. They don't want to connect with people. Two is limited positive affect. Now, positive affect is like all these happy, positive facial expressions. That's what we call affect, is like how we express ourselves to others. Blunted would be nothing. Make sense? The third is episodes of unexplained irritability, sadness, or fearfulness that are evident even during non-threatening interactions with adult caregivers. I think of this kind of as like that hypervigilant feeling that a lot of children will have that have gone through things like this, and they'll all of a sudden feel really irritable and agitated and they won't know why. Number three, rearing in unusual settings that severely limit opportunities to form selective attachments. The examples that they give are institutions with high child to caregiver ratios, so they don't really get much attention, maybe no attention at all. Even if they maybe fall and hurt themselves, maybe nobody sees that has happened. And the other important criteria I'm going to discuss is the fact that the criteria cannot be met for an autism spectrum disorder. The disturbance is evident before the age of 5, and the child has a developmental age of at least 9 months. So between 9 months and 5, and they can't be on the autism spectrum. And I think those are really important. As a clinician, I'm always looking for age ranges and also limitations. So if there's already a diagnosis of this, does that rule out that? And we call that kind of like differential diagnosis in the therapy world, but it just means we're making sure that we're giving you the diagnosis that best fits your symptoms. Also, it's important to note that it says that the disorder must have been present for more than 12 months, so more than a year. And also, I want to read this little this kind of caveat, because it says it's unclear whether reactive attachment disorder occurs in older children, and if so, how it differs from its presentation in younger children. So even if it happens in older kids, does it look any different than this? Maybe not. Because of this, the diagnosis should be made with caution in children older than 5 years. So that's just telling us, it's almost like personality disorders. We're not supposed to give that diagnosis before someone's 18, but some people do, but they do it with intense caution because they feel like they do meet the criteria and there's been, consistent symptomology, things like that. But just something to consider when we're talking about this diagnosis. So now I just want to have a little real talk. Reactive attachment disorder is something that usually occurs in physically or emotionally abusive family systems. Not always. This can happen, like we said, from foster care. There can be a lot of other situations and scenarios that cause children to develop this, but you're going to see what the treatment options are, and I just want to put that out there because it's children who are usually helpless to their environment, can't do much to get out of it, and so they kind of take it inside and often, will just cut off from people. They might not even cry when they hurt themselves. They'll just curl up and they want to look away. They don't want to attach to anybody because it's not safe. It doesn't feel safe because maybe they've been abused, or maybe they've seen someone be abused, or maybe they've seen something that's really traumatic that no one talked about and no one explained, but they just didn't feel safe. So a lot of the treatment options you'll see fall under like familial support and parent training and all of those things. And that's really why, because it happens when we're young, and it usually happens because of some kind of trauma, abuse situation being passed around, not being able to properly attach to a caregiver. And that's really important in our development. Now, there are 4 treatment options that I'll talk about. And the first, I'm just looking at my notes because I take notes, is family therapy. And it's just like what I said, because the situation is usually occurring in the family or has occurred in the family, it's important for the whole family to work together to start talking about it, especially if there's more than one child. Chances of the other children having it too are very high. And so we want to make sure that we're changing the way the family interacts, the way the family talks about it, and just overall improving their function as a whole. The second option is individual therapy and or play therapy for the child. This can be great, and I always, if it is one child who's really struggling, I would always recommend that they get their own therapy or play therapy, because sometimes in family situations, as children, they can feel fearful of speaking up because of what may happen in the family. And so giving them that one-on-one time can allow them the support and guidance to talk about what's really scaring them or what really happened and get the help that they need. The third treatment option, and something that I actually used to teach, funny enough, is parenting skills classes. And these can be everything from how to manage an infant and ways to better deal with that, to how to properly discipline a child. And even, I used to teach these, how to manage teenagers. Because we know it can be hard, right? And so they may want you to take a bunch of different ones. They may ask the parents to talk about disciplining a child, especially if there's abuse present or if it was a trauma related to something like that. Also, they'll make you take communication classes and better ways to communicate with a child. All of those different types of classes are available, and those are things that may be forced upon you through legal action, or something that you may get from your therapist that you're seeing either in family therapy or in individual therapy. And the fourth and final treatment option, and it's not so much a treatment option as it is just extra support and aid, is special education services. If your child is in school, there are so many different things. I know I've talked about IEPs, which are individualized education plans. There are a lot of things that schools can do to better support your child if they're struggling, because reactive attachment disorder can mean that they might not pay attention, they might struggle to pay attention, they might be really shy, they might not make friends. School may be a really difficult area for them to be in, an area for them to navigate, and having some support in the school system can really, really help. There are services available, sometimes we just have to ask for it. I hope you found this helpful. If anybody that you know is fostering children or in that system, please share this video. It's so important. The more we talk about this, the more we're aware of it, and we can catch the symptoms early and get them the support they need before it gets harder. And if you want more information on this, click over here. And if you're new to my channel and you haven't subscribed, why not? Click over here to subscribe, and if you want to see what I'm doing on the regular, click any of these little icons to follow me all over the social medias, and I'll see you next time. And aid is Jesus. Jesus. Just pray. Pray it gets over with. Okay. Now, the diagnostic criteria of reactive attachment disorder. Wow, that's a mouthful. Let me start over. 3 is rearing in unusual settings that severely limit opportunities to form selective attachments. Get it together.